The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, and welcome to Are We Making Progress in Child Obesity in Texas? Results from the 2015 to 2016 SPAN study. My name is Donna Nichols. I'm a faculty associate and community health specialist with the Michael and Susan Dell Center for Healthy Living and moderator for today's broadcast. I'm happy that all of you have joined us today. Joining me today is also two exceptional presenters. One is Rama Leith. Rama is with the Texas Department of State Health Services. She is the State Child Health Coordinator. Also joining us today is Dr. Deanna Helsher. Dr. Helsher is with the UT Health Science Center at Houston, School of Public Health here in lovely downtown Austin, and she's the director of the Michael and Susan Dell Center for Healthy Living. I am sure both Rama and Deanna will share their role, and it's extensive, and the importance of this data to the state of Texas. Today, you are the first to get a sneak preview of this data, which is unique only to Texas. Before we begin, I would like for you to submit your questions as soon as possible. We have more than 150 registrants for today's webinar, and so it's important that you get your questions in early. We'll conclude at around 11:45 with our questions, so it's important that you get them in as soon as possible. I'd also like to talk a little bit about our hosting organizations today. Of course, the Texas Department of State Health Services is a hosting organization, as well as the Michael and Susan Dell Center for Healthy Living. Also today, Live Smart Texas, for those of you who've not heard of Live Smart Texas, is a hosting organization. For those of you who are not involved with Live Smart, and we extend an invitation to you to join it, Live Smart is a coalition of organizations and individuals who work together to address the state's obesity epidemic, especially in children. LST, as we fondly call it, was founded in 2007 with the idea that it takes more than one voice to make change. LST members represent a variety of organizations and disciplines, and we ask that you consider joining. LST is actually led by two exceptional individuals as well. They are Dr. Diane Dowdy and Dr. Hoda Sana, both of which could not be with us today, so they have very graciously allowed me to talk about LST. As you can see, we have members from each health service region, and in fact, we have a regional representative who sits on the steering committee. For those of you who've not joined, we would be happy to get the list of regional representatives to you so that you can join that particular region. As you might guess, our guiding light is around these particular aspects of the work. First, to connect and build relationships with others. Secondly, to access opportunities to engage in collaborative research and partnerships, and to share best practices with and learn from the experience of others, as well as to create a unified and united obesity prevention policy agenda, and to share and bring resources to the state of Texas. Again, LST is a hosting organization. So I would like to start with Rama Leith, who again is our State Child Health Coordinator, who will introduce SPAN. Rama?
Thank you, Donna. Hello, everyone. I'm so happy to be with you all and have you all joining us today. As Donna mentioned, my name is Rama Leith, and I am the State Child Health Coordinator for the Department of State Health Services in the Maternal and Child Health Division. Previously, as of September 1st, we were the Title V Maternal and Child Health section. I have had the great pleasure to work with Deanna Helsher and Carolyn Smith and their team through funding and supporting the efforts of the School Physical Activity and Nutrition Survey, SPAN. SPAN was previously conducted in the school years 2000 to 2002, 2004 to 2005, 2009 to 2010, and currently in the school year 2015 to 2016. In this edition of SPAN, we included second grade children and parents, surveying students in 2nd, 4th, 8th, and 11th grades, as well as children in the border areas. As the only statewide child obesity data source, the Maternal and Child Health Division will continue to fund the SPAN survey in FY18, including the border regions. Surveillance of children in grades 2nd, 4th, and 8th will also continue. Data collected during the SPAN project is used to report regional and statewide findings, as well as to advise and improve child health programs and policies in Texas. So with that, I would like to pass this on to Deanna so she can provide you all the great resources and data they've collected in the 2015-2016 SPAN data collection. Thank you all.
Thank you, Rama. I'm Deanna Helsher, and I'm very pleased to present on our SPAN data. So today's presentation, first of all, I'll go over a little bit about SPAN background. Then I'll talk about our methods, including our measures and our protocols. And then I'll present some preliminary results. Finally, I'll end with some conclusions and implications, and we do have some resources available, and I'll mention those at the very end as well. Before I begin, I just wanted to acknowledge the many partners that helped pull this together. So our funding, as you heard, was from the Texas Title V Maternal and Child Health Services. We also received additional funding by the Michael and Susan Dell Foundation through the Michael and Susan Dell Center for Healthy Living. With a state the size of Texas, you really have to rely on a lot of people for data collection and coordination of efforts. And as you can see there, there's a lot of other acknowledgements. The DSHS Office of Border Health, we relied on a lot of the School of Public Health campuses, and then many other groups, including the Area Health Education Centers, DSHS Region 4-5, and Region 9-10. We also used a lot of student help with this through UT Health School of Nursing, the UT Health Science Center Regional Campus in Laredo, and UT Tyler Nursing. And finally, the City of El Paso, Department of Public Health. And a final thank you is for all the school districts, children, schools, and parents who participated in the study. I'd also like to acknowledge our SPAN research team. I'm the lucky one that gets to talk to y'all about all the fun results, but there are a lot of people behind this team, everything from field coordinators to statisticians. So I'd like to give a shout out to them right now. So what is SPAN? SPAN is the School Physical Activity and Nutrition Project, or SPAN as we call it here. SPAN is a surveillance system, and it monitors the prevalence of and secular trends in obesity and overweight in school children in Texas, as well as other obesity-related factors. As Rama mentioned, information from SPAN is going to be used to target programs and policies to address overweight and obesity among Texas youth. It's really important that we collect these data for the state of Texas. We know that about 1 in every 10 children in the U.S. live in Texas. So what happens here really does make an impact on the U.S. obesity prevalence among children. SPAN 2015-2016 is the 4th time this statewide project has been conducted. So we're very happy now we have enough data to do trend analysis. So just a brief overview of the past SPAN surveys and data on this slide. We started, as Rama mentioned, in 2000-2002. At that time, we measured all of the health service regions in a 2-year panel. Throughout it all, you can see that we measured grades 4, 8, and 11. So that's kind of a consistent throughout that. In SPAN 2009 and 2011, we added 4th grade parents in addition to the children, And this most recent iteration of SPAN included second graders. In addition to the health service regions, in 2009 and 2011, we added border and non-border regions, which we continued this time as well. We also collected some data on school health policies in 2009, 2011, and this year we did that as well as vending machine audits, the campus improvement plans, and signage observations. So SPAN collects both objectively measured data as well as self-reported data. So we measured heights and weights for students from all of those 4 grades, and so we actually went in and measured heights and weights. This is a little bit different from some of the surveillance that you see on kids where they might collect heights and weights from FitnessGram, or in the case of the Youth Risk Behavior Survey, they ask the kids to record their height and weight. We actually obtained these heights and weights in the field. We also had a self-report questionnaire that has been validated that was administered to students at 4th, 8th, and 11th grade. And then we had a take-home survey for parents of second graders. So these surveys covered demographics, diet and physical activity behaviors, knowledge, and then some other health-related questions. So our sampling design, I'm going to talk about that just a little bit. This is a representative sample. So these data represent the kids in Texas. So this is a multi-stage probability-based survey. And as I said, not only does it yield representative data at the Texas state level, but also at the health service regions, although the health service regions are divided a little bit differently this year, and at the Texas-Mexico border and then non-border areas. The sampling weights are available for each level, and the counties, how we derived the Texas-Mexico border area, it's the 32 counties that meet the criterion of the La Paz Agreement of 1983. So those are defined as counties that are border counties. So the strata were designated by health service regions, and we had both urban and rural areas. So as you can see here, the health service regions were divided into 6 categories. So 1 and 9, 10 were sampled together. Regions, health service region 2 to 3, 4 to 5 north, 6 to 5 south, which is the Houston area. 4 to 5 north is Tyler, 2 to 3 is Dallas area. 7 is Central Texas, Austin, and 8 and 11 include San Antonio down through the Rio Grande Valley. The definitions for rural and urban followed the Department of State Health Services definitions. And the sampling frame include eligible school districts in Texas for the first stage, a list of schools within each district for the second stage, and then classrooms within the third stage. So for the first 2 stages, we did PPS sampling, and then we had a fixed number of students at the last stage. So our statewide participation was actually very good for this survey. So the number of districts surveyed included 70, and we surveyed a total of 280 schools. So you can look there and see the unweighted number of students and parents participating, and it ranged from 2317 for the second grade parents to 6,180 for the 4th graders. You can also see the population that they represent. So in each of these cases, we're representing roughly 300,000 children for each of these samples. We had a total unweighted sample of over 17,000 children, which represented 1.3 million school-age children in Texas. Just for comparison's purpose, the 2011-2014 unweighted sample for N. Haynes collected 6,878 data from 6,878 children aged 2 to 17. So now I'll go into some of the results now that I've kind of gone through the basics of the survey. So this is where it gets interesting. So the gender distribution between boys and girls is fairly equivalent, as you see here. The racial ethnic distribution is very interesting this year. This was the first time that we've had majority Hispanic kids, which is consistent with the population representation of that. So as you can see, it's 50% or above Hispanic in all grades. The median age for each grade, as you might expect, increases, and it ranges from roughly 7 to the second graders through 9 to the fourth graders, 13 for the eighth graders, and 16 to the 11th graders. So now we're going to talk about the weight status. So this is the data that everybody's most interested in. So the weight status categories for children 2 to 9 are defined using BMI percentile cut points with the CDC growth charts. So in some of these slides, I will show the data in different ways. So underweight is defined as lower than the 5th percentile BMI. Healthy weight is between the 5th and the 85th percentile BMI. Overweight is defined as the 85th to right at the 95th percentile. And then moderate obesity is 100 to 119% of the 95th percentile BMI. And then this year we looked at the data in another way that's kind of gaining popularity. We looked at severe obesity, and this is defined as 120% or greater of the 95th percentile BMI. So this severe obesity category was developed to accommodate the inadequacy of the percentile BMI to kind of capture the risk at very high ranges. So we know that obesity in kids, particularly in the severe obesity category, has been increasing. And so the reference for that is on the slide, the Friedman article in Obesity that came out earlier this year. For some of these slides, we'll show all 5. For some of the slides, we'll show obesity. When we talk about obesity in these slides, it's moderate and severe obesity all together. And that's usually how it's represented with a lot of the national surveys. So if you look at Healthy People 2020, Nutrition and Weight Status Objective 10 seeks to reduce the proportion of children and adolescents who have obesity by 10%. And so really what we're trying to move toward for Healthy People 2020 is a prevalence in children ages 6 to 11, which would be our second and fourth graders, of 15.7%. And the 12 through 19-year-olds should be 16.1%. So if you can keep 16% in your head as we go through these next few slides, it will be a good comparison for you. So these data right here show the weight status by grade for SPAN, and this is for 2015-2016. So in looking at these, it goes from 2nd, 4th, 8th, and 11th grade. The orange is underweight, the green is healthy weight, the blue is overweight, the red is obese, and the purple is severe obesity. So if you look at these, you can see that the rate of underweight is very low across all grades. So while it is of concern, it is fairly low compared to what we see with obesity. So if you look at the prevalence of overweight, it ranges from 14% in second grade to 17.9% in fourth grade, 16.5% in eighth grade, and 19.5% in 11th grade. If you look at moderate obesity, then it ranges from 13.5% in 11th graders to 17.9% in fourth graders. Then the other thing that is especially interesting to us is looking at the severe obesity in this chart. So severe obesity is around 9 percentage points for fourth and eighth graders, 8.2% for second graders, and 6.7% for 11th graders. So how does that compare to the U.S. average? From NHANES in 2013 and 2014, if you looked at ages 6 to 8, extreme obesity was 4.3%. So in Texas, our kids in 2nd and 4th grade have about twice the prevalence of severe obesity as the U.S. in general. In ages 12 to 19, the prevalence of extreme obesity was 9.1%. So 8th grade is about right where the average is in the U.S. 11th grade is slightly less. Nevertheless, this is great concern to us because this is the area that seems to be, this is the prevalence that seems to be growing the most. And these are our data for this year. So as I said before, these data allow us to look at trends over time. So these are the obesity trends in kids from 2000 to 2016. So the orange is grade 4, the green is grade 8, and the blue is grade 11. So if you look at those, we did have a dip in grade 4 between 2004, 2005, and 2009, 2011. It has kind of jumped back up with our most recent data in 2015, 2016. In 8th grade, it was similar between 2000, 2002, and 2004, 2005, but then it went up in 2009 and 2011, and then it went up again in 2015, 2016. Grade 11 started very low in 2000, 2002, and went up for the next 2 rounds of SPAN, and it's kind of held steady with the last data collection in 2015, 2016. We have not finished completing our data analysis, our trend analysis on this yet, so we don't know if it's statistically significant, these increases that we're seeing, but nevertheless, they are concerning. They're not going down, and they don't even appear to be leveling off for the most part over this time period. Here is the weight status distribution by border, non-border, and these are just the percent of students who have obesity. So we're just looking at obesity, moderate and severe obesity here. So when you look at these graphs, the orange is non-border, the green is the border population. So among 4th, 8th, and 11th grade, in every situation, the prevalence of obesity is higher among the border population of children. It is especially, this difference is especially wide for the 11th grade kids, where it's almost 10 percentage points difference between the prevalence of obesity at the border compared to kids who live in non-border regions of Texas. The next biggest difference between the two is in 4th graders. So these graphs, and apologies, some of them are kind of light. When you look at these across time, the top row is grade 4, the middle row is grade 8, and the bottom row is grade 11. And so if you look at them, the gray, the very gray white shows a percent obesity of less than 15%. The light yellow is 15 to 19.9%. The orange is 20 to 24.9%. The darker orange is 25 to 29.9%. The red is 30 to 34.9%, and then the purple is above 35%. So this is the percent obese by health service regions, and so you can see how it changes from different regions of Texas. And then you can see from 2000 all the way to 2015, 2016, the 4 separate time points. So if you look at grade 4, the highest prevalence of obesity is in grade 4. And as you can see, around the border areas in Houston were the highest prevalence when we began doing SPAN in 2000 and 2002. In 2004 and 2005 was when we saw that significant decrease in the El Paso area. And you can see how the colors went from dark orange to the light yellow. In 2009, 2011, it kind of jumped up again in the El Paso area and the border areas and in East Texas. And then in 2015, 2016, one of the things we see is that there's no region in Texas with fourth graders that has a prevalence rate of less than 20%. And it's especially high among the border regions, South Texas, and then in Houston. If you look at grade 8, in 2000, 2002, the prevalence was pretty low across the state in general. You can see kind of a darkening and increase in prevalence in East Texas in 2004, 2005. In 2009, 2011, you can kind of see the prevalence increase except for Health Service Region 7. And then in 2015, 2016, you see a prevalence rate of 30 or greater, which is in the Dallas area, 2-3. You also see a high prevalence in South Texas. And then for grade 11, as you recall, they had the lowest prevalence of obesity. And the first year we did this survey, we had prevalence above 25% down in the Rio Grande Valley. The next year we saw improvement across the state. In 2009, 2011, we saw a little bit higher prevalence across all the health service regions. And then in 2015, 2016, we're seeing especially high levels in regions 2, 3, and in regions 8 and 11, health service regions 8 and 11. Again, you see that health service region 7 seems to have the lowest prevalence compared to the others. Again, we have not done statistical analysis of this yet, but we wanted to kind of show you, because we know that people are always interested where they are, how the local data are doing. So here is the weight status categories by grade and race ethnicity. So if you look at this, the green is healthy weight, the yellow is overweight, and the orange is obese. And again, this includes both moderate and severe obesity. And the highest prevalence of obesity are found among African American children in grade 8 and Hispanic children in grade 4. You also see a high prevalence of obesity among African American children in grade 4. In Hispanic kids, you see a high prevalence in grade 2 and grade 8. And as you see, the prevalence decreases for any of these racial ethnic groups at grade 11. So you tend to have a lower prevalence across all of these groups in high school. So now we're going to transition out of weight status and talk a little bit about dietary practices. So on the SPAN survey, we had several questions that ask about how many foods, what kind of foods and how many foods you ate on the previous day. So here we're showing the data for 2nd grade, 4th grade, 8th grade, and 11th grade. So I want to preface my remarks by reminding you, although we weighed the 2nd graders and obtained their height and weight, the parents filled out their surveys. Whereas the children filled out the surveys in grade 4, 8, and 11. So it's a slightly different place where slightly different data source for those two groups. So first we're looking at the percent that ate no vegetables on the previous day. And if you look at that, it ranges from over 25% to over a third. So that's really a little bit alarming that you had this many kids that ate no vegetables. And this is not counting potatoes. So potatoes, chips, things like that were not included in this question. So as you can see, the 2nd graders did a better job of eating their vegetables, slightly better than the 11th grade. But in the 11th grade, it's over 36%. The percent of children that ate no fruit during the previous day ranged from about 13% to 23%. And again, that increased as the kids got older. So what we're seeing is the high schoolers tend to consume fewer fruits and vegetables than the younger kids. The percent of kids that consume sugary beverages at least once during the previous day is really relatively high. So it's around 60% for almost all of the for all of the grades except for second grade, and that was at 53%. And so that's interesting to us that even with parents self-reporting and the kids reporting, you still had a significant number of children that still consumed at least one sugary beverage during the previous day. And then the percent of kids that ate sweet or salty snacks at least once during the previous day was very high. It was over 80% for all of the kids and close to 90% in second grade and eighth grade. If you look at these data by themselves, there were a significant number of kids who were eating 3 or more sweet or salty snacks during the previous day, which is really a very high prevalence of consumption of these foods. So these data here show the mean number of times specific food groups were consumed on the previous day by grade. So what I showed you there were the percent that had either no or more than one. These are kind of the averages of these different foods. So if you look at these, the top bar, the yellow, is 11th grade, the gray bar is 8th grade, the orange bar is 4th grade, and the blue bar is 2nd grade. So looking at this right away, you can see that the kids eat more sweet or salty snacks than they consume vegetables or even fruit or fruit juice, with the possible exception of the second graders who consume quite a few fruit, especially when you include fruit juice in there. When you look at sugary beverages, the mean is about 1 per day, a little bit lower for the second graders. If you look at the servings of fruits and vegetables together, you've got a mean of about 2.5, 2.83 for the kids if you looked across those. And that is pretty consistent with similar survey data that we've seen in the past. So because the recommendations are much higher than that, we certainly have a ways to go with encouraging kids to eat fruits and vegetables, to avoid a lot of sweet or salty snacks, and then to avoid drinking sugary beverages. So now we're going to switch to physical activity and talk a little bit about physical activity practices. So here, the first line of this looks at mean days per week of at least 60 minutes of physical activity. And as you can see, the older kids and the second graders all tend to get about 4 days of at least 60 minutes of physical activity a week. The fourth graders had slightly fewer days reported. This is one question. We're kind of looking at the results again. This looked a little bit low to us, so we're still continuing to kind of look at those data. The percent that engaged in 60 minutes of physical activity for 1 or fewer days a week, if you look at this, about almost half of the fourth graders did. About a quarter of the second graders engaged in 60 minutes of physical activity less than 1 day a week. And then if you look at the 8th and 11th graders, they actually got a little bit more physical activity. It was very concerning for us to see that among the elementary school kids. So if you look at the number of sports teams to which they belonged, you saw it peak in 8th grade. And that makes sense because a lot of the extramural sports are offered around 8th grade. And then when kids move into high school, sometimes the opportunities aren't there. It tends to get a little bit more competitive. The percent that are in any organized sports, if you look at it, tends to peak in 4th and 8th grade. So it's around 75%. In 2nd grade, it's around 50%, and in 11th grade, it's about 2/3 are in any. And this included both team sports as well as things like tennis lessons, ballet, karate, martial arts, those kind of lessons as well. So now let's look at what they're doing if they're not exercising. So one of the things they might be doing is spending more time on TV and electronic devices. So these graphs here show the time spent on TV and electronic devices by grade. And so as you might imagine, they spend a lot of time on electronic devices and TV. So the hours spent on computer or similar electronic devices is depicted in blue here, while the orange shows the hours per day spent watching TV. And so if you look at this, it's lower in second graders, and second graders tend to watch TV more than they're on electronics. But then it switches at fourth grade. And then in 8th and 11th grade, it's very high. So if you're looking at that, it's 4.5 to 5 hours that they spend on computer or similar electronic devices. And these were outside of school time. So we did ask about inside of school time. And then if you look at the hours per day spent watching TV, it tends to be about 2 hours for the older kids, a little bit less than that for second graders. 2 hours is about the limit that the AAP had recommended. The new recommendations are a little bit different per day, but we still think that this is right at the limit. So there are several kids that are exceeding that. So we also asked the kids, or the parents of the second graders, do you have a TV in the room where you sleep? And interestingly enough, we found that the TVs kind of get added to the kids' rooms as they get older. So in second grade, over 50% had a TV in their room. So the green is yes, the orange is no. In fourth grade, it was over 60%, and then it's 70% in 8th and 11th grade. Watching TV in the room has been associated with lots of things, including decreased sleep, decreased grades, a lot of other, and obesity as well. We also asked, do you have a computer, iPad, tablet, phone, or gaming console in the room where you sleep? And so these are newer data. So we haven't seen this question on a lot of surveys before. Interestingly enough, on the second graders, the majority of them did not have a computer, but 36% still did. A computer, or it could have been an iPad or tablet or an iPhone or smartphone. When you look at fourth graders, though, 70% have some kind of connection to the internet in their rooms. And then in 8th and 11th grade, it's close to 80%. So this is a separate question. So they could have, it looks like several kids, and we haven't looked at the overlap yet, have both a TV and some kind of link to the internet in the room where they sleep. So those are the data that we have to present to you today. It kind of gives you a peek at some of the data that we have, some of the grade differences, some of the differences over the years. There's lots more data there, so we're just beginning. But if you want to get more information, we have a set of 2015-2016 SPAN fact sheets that are on the web, and you can see the website there. And they present data for children across the state, as well as by the different health service regions. So many of you out there, you can find local data, or as local as you can get it from this. So feel free to go there and download these PDFs and let us know if you find these useful. So in conclusion, school children in Texas have high rates of obesity, and those rates might be increasing. So we need to look at this. We need to do a little bit more analysis before we say that for sure. But regardless, there evidently is a need to increase our focus on child obesity prevention. Texas was a leader in child obesity prevention legislation, but I know throughout the years, a lot of the support, a lot of the gains that we've made have been slightly eroded by by watering down some of the legislation. So that might be something that we want to look at in the future and see how we can kind of shore up some of those obesity prevention policies. We also see disparities in the prevalence of obesity, and those are by subgroup, border, non-border, and health service region. So again, we've just begun to scratch the surface on these data, so we will be able to look at a lot of the dietary data and physical activity data by border, non-border, and the health service regions as well. But what we do see is that we do need more concentrated efforts and resources. So we do know that there's a higher prevalence on the border and in certain regions of Texas. And some of those might require evidence-based programs as well as policy systems and environmental changes. A lot of these increases that we've seen tend to accelerate between the 2nd and the 4th grade. Now, we did have parents fill out the 2nd grade surveys because 2nd graders just can't fill out the surveys with appropriate validity and reliability. However, there does seem to be something that happens between 2nd and 4th grade. So that is something we want to kind of keep our eye on. We also found that data at the health service and border region are useful for helping us identify these trends and areas of greater need. As you know, we want to be good stewards of government funding, state funding, local funding. And to do that, we need to prioritize our efforts and resources. And we also want to see what's been working and keep going with that. So that's another part of this whole idea of prioritizing efforts, keeping what we have going, and then adding other efforts and resources. A couple of other things that kind of struck us is a significant number of children don't consume fruits and vegetables on a daily basis. So in a state like Texas, where we grow a lot of fruits and vegetables, that really should be key for some of our programs. And then we also find that a significant number of children have TVs or other electronics, phones, computers in their bedrooms. So for that, we really need better parent education. A child is not necessarily going to refuse a TV or an electronic device in their bedroom, but parents can regulate that. So those are some just very brief recommendations. And as I said, this is only the beginning. All of the schools who participated in SPAN, the districts will be receiving individualized report. They can use that to apply for different grant funding or use that for presenting to their school shack or their superintendent as well. So we have a lot of other deliverables and resources coming out of this project, and really hope to take full advantage of this data set. We have a lot of publications underway. And with that, there's my contact information, and I'll turn it back over to Donna.
Thank you so very much, Dr. Helscher and Rama, for doing such an exceptional job. You know, I know all of you out there in the state of Texas are going, what a phenomenal resource. And in fact, the first question that has bounced over this way says compliments to the Michael and Susan Dell Center, Dr. Helscher and her team for doing an exceptional job on a data set that will be well used by all of us here in Texas. And compliments to the Department of State Health Services and Rama and her staff for having the vision to support such a wonderful survey that is very unique to Texas. And again, that individual said compliments to all that are involved with this. Attached to that wonderful compliment is a question that kind of goes like this. And it's actually some of the things that Deanna was just talking about, and that is now that we have a picture of what is happening in health service regions and among 2nd, 4th, 8th, and 11th graders, what do we do next? And I think that's a question for not only Dr. Helscher, but a question for the Department of State Health Services and Rama. So Deanna or Rama, feel free to step right into that question.
Well, I think, first of all, I think having these data kind of show us where we might start working. So as I said before, we are planning to meet with Partnership for a Healthy Texas and provide these data to them so that they can use them when they develop an obesity platform in terms of legislation. I think the other thing that can be done with these is taking it back to the local school board or the SHAC committee and having them work on solutions. All the SHACs are required to come up with school wellness policies. And so having data like this would enable them to look at what evidence-based or best practices are available and maybe allocate some resources in the schools for doing some of that. I know it's really difficult for schools because funding is always an issue. And this is one more thing that's asking for funding on top of other needs that school districts might have. However, we do know that kids that are healthy tend to learn better. And so I think as part of this, these data really should mobilize us to kind of move this forward. There also are a lot of changes you can make within the school district in terms of policies within the school district that might help increase availability of fruits and vegetables, might make it easier for kids to get exercise during the day at school, and so on.
Excellent. Rama, would you like to add anything to that response?
Dan, of course, did an excellent job covering all of the areas that we need to focus on, and I really feel this data gives us a good representation of where we need to start putting our efforts. Definitely in certain regions, we have a higher association with obesity and lack of physical activity and healthy eating. And in particular, what I notice is the TV watching and also the use of electronics, which we could definitely provide some more education to parents. I think maybe that's something that's missing. The policies in schools, we need to keep working on that. That needs to really happen, working with PTAs, working with our communities, in our health region areas, with our regional staff, working with the schools and the PTAs and so forth as well, and getting that education to parents. I think there's just a lot that can be done, but we really need to focus on those policy systems and environments where the children are the most, and that's often at home and at school. So putting a lot of focus in those areas, I think, is really important.
Thank you, Rama and Deanna, for those responses. And it sounds like we're in concert on direction. I really like this question that just popped up. It seems like Region 7 is doing something right. What's working there that is different than any other region?
Well, first of all, I have to say that what we're looking at are serial cross-sectional data. So it's not, it's a different kind of study. It's more of an ecological study in that approach. So there's a lot of unknowns. So I can't tell you for sure. It's not like a randomized controlled trial. However, what we've seen previously, if you look at the El Paso area, what happened between 2000, 2002, and 2004, 2005 is Paso del Norte Health Foundation put a lot of money into different programs that were done. There was a lot of work on legislation at the time. And so between that and all the programs being done, we saw that decrease in child obesity in Region 910. Unfortunately, what happened is a lot of those programs ceased to be funded right after that, between the 2004, 2005, and 2009, 2011 surveys. And so we saw the prevalence of obesity kind of come back up in Region 910. So again, what I'm saying, it's speculation, but you can kind of look at what happened for an ecological type study. I would say in Region 7, what's happened is there's been an incredible amount of funding, much of it through the Michael and Susan Dell Foundation. I think there's been a lot of other initiatives happening here in the Central Texas area. So I think a lot of that has provided a good synergy. There's a lot of nonprofits located here. And what we're starting to see is some of that momentum is happening in other parts of the state too. So hopefully we might be able to get a little bit more information together to look at this. But what I will say is it does seem to appear that when you have concentrated efforts and a lot of people kind of working toward the same goal, it does seem to produce differences on a population level.
Wonderful. Here's another question. Is any of this research taking into account the stress level of children? Thoughts, Dr. Helscher or Rama?
We did have some questions about stress with the parents. We do have a series of questions on bullying in the school. I did not present those data here today. I know that in particular, DSHS is very interested in analyzing those data and looking at them in more depth. So as I said, this is kind of a first peek. We will be talking about that. And I know that bullying is a source of stress among children. We also have some questions on e-cigarette use among the 8th and 11th graders. So it'll be real interesting to look at the associations between that and obesity with measured data. Our T-Cores group has done it, but it was self-reported heights and weights. And we have 2 different age groups. So this is a little bit broader question. We did have some questions on asthma and diabetes as well.
Well, as you can see, this survey is very deep and rich with data. I think we have time for maybe 2 more questions before we conclude today. And the other question that I see here is, are children being taught to read labels? Are we in a position to be able to teach children how to read labels? And what are we finding out about programmatic efforts that are out there?
That's actually a very interesting question. I know with the Catch curriculum, there is a session on reading labels. I know several other school-based curricula do focus on reading labels. I think one of the main questions is we have a lot of good resources in Texas. What we have found in our research is it's not always implemented fully. And so people might not teach all the lessons. They might teach just a few lessons. The homework might not go home to the parents where they can reinforce it. So our question is not necessarily always in having resources, but are they implemented to the point where they can make a difference on the population? I will say we just had a paper published using SPAN data from 2009, 2011 from label reading among the nutrition facts label reading among 8th and 11th grade kids. And what we found is the kids who read labels in general had better diets. So, again, it's cross-sectional. You can't assume causality, but it's an interesting association that we found.
Wonderful. We just had another question come in, and I really do want to ask this one. Has the relationship of these data been compared to the socioeconomic status of the regions?
We are actually looking at that right now. So with a lot of the statistical analyses we'll be doing, we will be controlling for socioeconomic status. So that kind of tells you, it will kind of account for that in the analysis. So we'll be able to tell you whether it is socioeconomic status or something else. Again, even though that's true, and we can tell you with a little bit more, in a little bit more definite way once we can finish our analyses, What I can tell you is just in looking at the data, you generally tend to see in the areas that are lower SES, they tend to have higher levels of obesity. Not necessarily everywhere, but in general, that is how it tends to fall, unless there's been extensive interventions in that area. So sometimes that will make a difference, as we saw in the El Paso area, for example. But I think that this holds true pretty much across the literature.
Excellent. One other question, Rama, this is probably largely for you as well as Dr. Helsher. What's the next school year that we'll do the next SPAN survey? Any ideas about that? Rama, we'll start with you. Any idea about when we might be able to do this one more time?
The next 2019 school year is most likely going to be the year we're able to do the next survey. So right now, as you're hearing, we are analyzing the data. We just received the data from the 15-16 school year, and we'll be going back and we'll be revising surveys and updating and so forth and getting more essential questions in there. And so our goal is to have the next survey happen during the 2019-2020 school year.
Wonderful. So one last question. Will these slides be shared?
Yes, we will be archiving this webinar, and they will be available on our website at www.msdcenter.org.
Okay.
Go
ahead.
We can send this out, the information about the website, to everyone who's on the call as well. Sorry, forgot to say that.
That's okay. Again, the last slide, www.msdcenter.org. And if you need to get in touch with Dr. Helsher, her email address is there as well. We thank everyone for joining us today. It is a pleasure to be able to present this wonderful data set to all of you here in Texas. Just remember, you heard it here first. Thank you so much. Y'all have a wonderful day out there, and we'll catch you next time around.